Evening News and streaming on the CBS News app.
Here we go!
Here in Minnesota, we're proud of our accomplishments. We still believe in our communities, and we protect our quality of life. We're even stronger when things get tough. WCCO has always been here, capturing the images and telling the stories from all four corners of this great state. More Minnesotans watch WCCO than any other source. This is not a coincidence. WCCO, always.
Everything that happens in this universe has to be the way it is. Life sometimes goes like you don't expect it to. What did you do to me? Turn it off. This is real.
I've got a question for you. What if you could watch all the CCO news you want and see all your favorite CCOers anytime, anywhere? Well, you can. Just download the app and poof, there we are, right there next to all those other networks you stream. Pretty cool, huh? CBSN Minnesota, built by CBS News, powered locally by WCCO.
Watch CBSN Minnesota on your Apple TV. It's so easy. Go to WCCO.com/Apple TV for step-by-step instructions. Watching CBSN Minnesota on your TV? When you're on the go, keep watching. Just download the CBS News app to your phone or tablet. CBSN Minnesota. It's free and always on.
Now, this is breaking news from WCCO.
Good afternoon. We are breaking into programming for the Department of Health's daily COVID-19 briefing. Let's listen.
If you require any further assistance, please press *0. I would now like to hand the conference over to your speaker today, Mike Schomer. Thank you. Please go ahead, sir.
Thank you, operator. And thank you to everyone for joining us for the COVID-19 daily media call from May 21st. Governor Walz is not on today's call. We'll start with the situation report from Commissioner Jan Malcolm. Following Commissioner Malcolm, we'll get updates from MDH Infectious Disease Division Director Chris Erzman and State Epidemiologist Dr. Ruth Linfield. After those updates, we'll open it up for questions from reporters on the line. With that, I will now turn it over to Commissioner Malcolm.
Thank you, Mike. Good afternoon, everyone. I'll begin, as usual, with the global and national update. Across the world this morning, we topped 5 million cases of COVID-19 and 328,000 deaths from this disease. In our own country this morning, we reported 1.55 million cases and nearly 93,000 deaths. Here in Minnesota, we added an additional 530 laboratory-confirmed cases yesterday, bringing our total to 18,200. Notably, this is the 6th consecutive day of fewer new cases than the day before, which is certainly a trend that we like to see, but quite honestly, we don't expect that trend to continue. As we know, we have other indicators in the system of cases growing as we test more. Unfortunately, we had an additional 32 deaths reported yesterday from COVID in Minnesota, bringing our total to 809 Minnesotans who've lost their lives to this disease. 17 of these people were in Hennepin County, 6 in Ramsey, 4 in Anoka, 2 in Washington, and 1 each in Clay, Dakota, and Goodhue counties. Demographically, the total includes 12 people in their 90s, 12 in their 80s, 6 in their 70s, 1 in their 60s, and 1 in their 50s. Of these 32 deaths, 28 occurred associated with long-term care facilities. As of today, there are currently 566 patients currently in the hospital, 229 of those in intensive care units. This is a net increase of 16 patients over the prior day, 17 additional in ICU. I'd like to just talk a little bit about the progress that we've been making on the long-term care 5-point plan that we introduced a little over a week ago. We touched on a little bit of this in yesterday's press briefing, but I'd like to just revisit it today. Very significant work has been done to stand up the long-term care plan, which we have been working on actually for quite a bit of time, culminating in our public announcement of the new elements of the plan. We've developed a process to schedule long-term care facilities to have all the testing that is needed. As you recall, one of the key parts of the plan was a new testing protocol so that in any facility with one confirmed case or 2 or more symptomatic people, all persons in that facility would be tested, would be offered testing. I need to stress that that is a voluntary process for the residents and staff in those facilities. So scheduling, getting this process in place to schedule facilities to be tested, including all the required logistical support to get the supplies tested and to get the tests processed timely and to get the case investigations started timely is quite a process, but we've made a lot of progress there. So far, we've tested 39 long-term care facilities across the state, which totaled more than 7,000 residents and staff. And looking forward, we have 30 facilities scheduled for testing over the next week. We've rolled out a survey system where facilities can request testing for their facilities, and so far 300 have responded, of which about 127 responded that they already had plans to test on their own. We've been holding weekly webinars for long-term care facilities since March. And then on May 14th, we held a special webinar to go over these new testing and guidance plans, which was extremely well attended by over 1,400 people. We also, as you know, have begun a partnership with the National Guard to enlist their assistance to do some of this testing. Guard teams that have been trained have the capacity to help us test up to 2,000 people each day. And during this month, we've had a real push thanks to the work of the procurement team at the State Emergency Operations Center to try to get more supplies and more personal protective equipment out to the long-term care facilities where they are very much needed. This would be gloves, cloth masks, N95 masks, face masks, and face shields, which are very much needed in the care of COVID-positive patients. We've also been working hard on staffing support. As we've said many a time, we know that the staffing challenges in our long-term care sector have been significant for a long time. This is a truly systemic issue that's been building over years. And the COVID-19 pandemic has just added further stress to an already challenging staffing situation in long-term care. We've built and put into place a volunteer management system that helps connect facilities to healthcare workers near them who have volunteered to be part of a surge force, if you will, in anticipation of staffing shortages. And we're also working to grow the number of staff in that volunteer pool that we can call on to help fill shifts, and also have a contract with the Federal Veterans Administration for additional workers for that surge force, as well as clinical staff from the National Guard who can be part of that system. We also finalized and distributed what I think is a really thorough and impressive toolkit for long-term care, which we've gotten some fantastic feedback from the CDC on as well. That this toolkit is extremely thorough, extremely in-depth, with links to many, many resources for long-term care facilities to help strengthen the plans that they have in place. And this has been distributed to more than 2,500 facilities in our state. It's available on the MDH website for anyone to take a look at. And we've certainly been stressing the presence of this resource in our weekly calls with providers. And we are also working more closely with our local public health colleagues to get them in a position to provide even more leadership than they have been to working with the long-term care facilities in their communities, because the local public health folks frankly know a great deal more than we do at the state level about the resources that can be tapped locally to support long-term care in these situations. And we want to be sure to fully leverage the skills and the knowledge of our local public health colleagues to make sure that these facilities get the supports that they need before, during, and after testing and beyond. So far, we've provided assistance on infection control measures to over 654 facilities, including how to properly use personal protective equipment and how to prevent, prepare for, and respond to potential outbreaks. And we've also completed all of the infection control related surveys of all of the skilled nursing facilities in the state that we were asked to do earlier this spring as a part of new Centers for Medicare and Medicaid Services guidance. So just a very lot of work going on to implement that long-term care support plan. Just a quick word on our testing status. Yesterday, we had over 6,200 tests processed by all the labs, and we've been averaging over 6,400 tests over the last week. So that's a significant improvement over the last couple of weeks, but not as fast of growth as certainly we are aiming for in the coming weeks. And we're still shooting for that goal of 20,000 tests per week by the 1st of June. So we've got a ways to go, but we have much better line of sight to where the capacity exists within the system, and now we're wanting to do more to, in addition to inviting and asking people with symptoms to come in and get tested. We're also developing more plans to have mobile testing sites in the community, and to be doing some proactive testing of populations, whether or not they have symptoms or feel sick. But if people do feel sick, absolutely we want them to get a test, and before they get a test or after they've been tested, even before they've got results. And certainly if they get positive results, it's so critical that they self-isolate and stay at home, as we have been reinforcing over and over again. Just want to mention again the importance of everybody understanding that COVID-19 is not only a concern for the elderly. Certainly we are all painfully aware of the increased risk that people of advanced age face, as well as people who have underlying medical conditions. But we tend sometimes not to think about how broad a list those underlying conditions actually are, including high blood pressure, diabetes, asthma, cardiovascular disease, chronic obstructive pulmonary disease, and cancer, as well as things like obesity, smoking, chronic kidney disease. All of these things put people at higher risk for severe illness from COVID-19. So it's that applies to a lot of us when you add up all of those different conditions. So we really just want to reinforce that this is a disease that can be extremely serious in people of all ages, especially so with this pretty broad list of underlying conditions. But we've also certainly seen cases of severe illness and even death in otherwise healthy younger people. So this is a big concern. We just want to make sure that everyone with chronic conditions is keeping on taking their medications as prescribed and continuing to get health care that you need, and to be in touch with your healthcare provider if you have any concerns or questions. We've talked a few times now about the critical importance of people getting the health care that they need and not being afraid to seek health care for conditions that are important to them. And of course, that final message of how important it is, even as we begin to have more places of business open and more opportunities for interaction, how important it is that we still keep in mind those overarching guidances to stay at home when possible, to practice social distancing, to wash our hands, wear a mask in public, to protect all of us, to protect ourselves, our loved ones, and our neighbors, and particularly those 2.5 million Minnesotans who fit into one of these higher risk categories. And with that, I am going to turn it over to Dr. Lynn, I think actually first to Chris Ayersman for some comments. And we do have Dr. Linfield on the line today as well to come back to your serology questions from prior days. But first, I'll turn it to Chris. Thank you, Chris.
Thank you, Commissioner. I want to take a moment to remind schools and the public that the public health guidance that was jointly issued by the Minnesota Department of Health and the Minnesota Department of Education pertaining to graduation is still in effect. Just a reminder that the safest way to observe graduation is for everyone to stay home. Indoor graduations and ceremonies held in outside stadiums and football fields of any size are not considered safe and are not permitted. If your school is considering a ceremony outside of the home, such as a car parade or a parking lot ceremony, attendees need to remain in their cars for the entire ceremony. As Governor Walz is starting to turn the social dials on activity, it's important to remember that large in-person gatherings with people from many different households is the last notch on the dial. And unfortunately, we are not there yet. It's not just the simple math problem of how many students can fit on a football field. It's also all the other considerations, the types of interactions participants would have with others, how predictable those interactions are, and the length of the interactions. Graduations are emotional events that can come with unpredictable social behavior. As we have seen with those who have attempted in-person ceremonies, even the best laid plans cannot account for the human reaction of students rushing to hug classmates who they've not seen in a long time. The logistics of the ceremony itself is not the only concern. This week, we've seen an example of a positive case associated with the setup for a ceremony. An individual helping to set up was in close contact with several other staff members over the course of a few hours to prepare a stage where a graduation ceremony was to take place. While the ill individual did not participate in the ceremony itself, the two individuals with whom they had contact did facilitate the ceremony. And the ceremony did involve individuals walking up to receive their diploma. Those two individuals did not yet know that they had been exposed and so were not in quarantine. And so this is just an example of another risk for transmission to a much larger population if procedures are not followed. So just a reminder that as much as we wish that we could be doing graduation, that we still, the guidelines are that is not possible at this time. And we appreciate you keeping that in mind. And with that, I will turn it over to State Epidemiologist, Dr. Ruth Linfield.
Thank you very much, Chris. So I understand that there have been some questions around serology. And so what I will do is just review some basics, then talk a little bit about some of the studies that we are planning and considering. As we have discussed on prior calls, serology is really a test that is looking at whether someone has developed antibody, a particular component of the immune response to, in this case, SARS-CoV-2. And some of the issues around serology for SARS-CoV-2 are that there are many, many different serological tests out there. Some of them do not have great specificity, and some may not have great sensitivity. And the reason why those are of concern is that you ideally would like to be sure that the result is a true positive or a true negative. And even among those that do have very good specificity, meaning they will pick up SARS-CoV-2 and that they won't cross-react with another virus or cross-react with something else, there is a concern concerned when the prevalence is low that the positive predictive value will not be so good. In other words, someone may have a result that they are positive and they may not be truly positive. As the prevalence increases in a population, the negative predictive value can drop. And so someone could be told have a result that they're negative when they're not truly negative. Sensitivity is being able to detect and pick up the antibody for the thing that you're interested in measuring. As you know, the state is partnering with the University of Minnesota and with Mayo Clinic, and they have done a lot of work to validate their serological tests, and they do have very good sensitivity and specificity. We are considering a number of studies that would incorporate serology. Some of the things we've discussed in the past, in addition to concerns about positive predictive value, there also is a concern about what does a positive result mean? Do we know enough yet to say that that person is protected from future infection? And we still don't know enough yet about protective immunity. So the way that we are using serology is really to look at how much of the population has been exposed. And we are going to be partnering with Memorial Blood Banks to take a look at the leftover plasma from blood bank donors at different points in time. So we'll take a look at now and then in the fall, as well as next spring, to get a sense of amongst that population, what proportion have been exposed. Now, blood bank donors tend to be healthy individuals, and so we also want to do a number of other studies to get at other parts of our population and community. And so another study that we are thinking of doing is a community assessment. Their CDC has a special kind of framework and study called a CASPR study, and that stands for CDC Community Assessment for Public Health Emergency Response. And that is where we go into the community and we choose households through a random process, and we collect information about symptoms and exposures, and we will include a laboratory testing component with that, and it's totally voluntary. We are planning to do this in 7 different parts of the state. We are also partnering with the University of Minnesota to do a number of other studies, and this will include looking at serology from grocery store workers. Another one is looking at healthcare workers. And then we do have a partnership with an investigator who has an ongoing survey that looks and evaluates physical health, mental health, economic security, and social dynamics. And we are going to include a serological portion of that. So we think that through this variety of studies that we will get some insight into different communities in Minnesota and to how they may have been exposed to this virus. I mentioned the blood bank study will go at different points in time. We are also considering that for the other studies as well. And we hope to gain some insight through these studies. So I'd be happy to address questions that you may have. And at this point, I'm going to turn it back to Mike Schulmer.
Thank you, Dr. Linfield. We'll open it up for questions now, and we apologize in advance that we'll need to wrap up the session a bit early today to get Commissioner Malcolm on to another commitment right after this call. As always, we'll ask the reporters limit questions to one primary and one follow-up so we can get to as many as possible. With that, operator, we're ready to take questions.
As a reminder, if you would like to ask a question, you will need to press *1 on your telephone. To withdraw your question, press the # key. And your first question comes from the line of Emily Evick, Care 11.
Hi, thank you for the update, everybody. I have a kind of in the weeds question here about the numbers that were released today. The cases that are defined as community transmission appeared to go up by a couple thousand, I think, and then the cases that are defined as unknown or missing dropped by about the same amount. So I'm just asking if is there some kind of change that happened where you decided to code a bunch of those cases as community transmission? And then do you have a response to that spike? Is that something we should be concerned about, as I know that's a key indicator that you guys are looking at considering the reopening restrictions?
Thank you for that really careful question. We're delighted that people are paying really close attention to the data. Chris, you want to take that one?
Sure. You know, I think yesterday we completed a record number of interviews, so about 900. So a lot of the missing data was cleaned up, so that likely could account for that change. Typically, you know, we have to call people sometimes, you know, multiple times before we reach them, and so they may be some basic demographics will be included for them in our data, but we'll be missing some of the other important information. And so, you know, when we have a day like yesterday where we reach, you know, 900 people, that can make a difference in what our data looks like. And then you asked about is it concerning that we're seeing additional community transmission? Certainly, we have said that there's a lot of community transmission happening, and we want to see that go down. On the other hand, we want people who are ill to be tested, and so that we're kind of at a point where we want two things that may be in direct opposition to each other. So we will likely see more cases as more symptomatic people are tested, but yes, our ultimate goal is to see our community transmission decline. And certainly if Dr. Linfield wants to add, she can.
No, I think you covered it well. Thank you, Chris.
Your next question comes from the line of Tim Nelson, PR News.
Hi, it's Tim Nelson. I'm wondering, obviously, the reaction of the Catholic bishops and the Lutheran Church Missouri Synod yesterday happened late, and I know that the health commissioner sort of addressed the distinctions that she was making in these services yesterday. But I'm just wondering what your fears of what may happen might be, particularly given the CDC study on the Arkansas outbreak and now the report of a positive case among clergy up in central Minnesota and Annandale.
Well, certainly, this is Commissioner Malcolm. As we discussed yesterday, as I think the governor has reinforced many a time, that we completely understand the value and the strong desire for reconnection with our faith communities, and you know, on so many levels, we're hearing the frustration of people who feel as though our guidance is overreacting and is overly conservative given the realities as they perceive them in their more local communities or among themselves and their immediate friends and family. But we just keep reinforcing the point that we just were talking about the degree of community spread, even when it hasn't completely been measured or isn't completely visible. And we just do know that church gatherings or religious gatherings, faith gatherings can pose some special risks just by the nature of who tends to be in the congregations, and certainly the guidance as faith services do become more prevalent, it will be really, really critical that precautions are in place that prevent some of what we know to be the greatest risks. But we just really, in this environment where cases are growing day over day, hospitals are getting more full, we're not at, but still on the way up that curve. I'm not at the peak, but heading toward it. We just continue to stress the value and the importance of doing the things we can do to protect the community from spread, and we appreciate that comes at a great cost and a great disappointment. But I think with respect to the faith community, that there is active conversation. Governor's in frequent conversation with faith leaders. I think we have a job to do to better explain the basis for our concerns and our reasoning. But I think, just as you said, there have been some very well documented experiences around the country and experiences here in Minnesota in a number of communities where there's been spread that wouldn't have been predicted based on kind of the way we think about this day to day. People don't perceive the risk to be applicable to them and their communities, but in fact it is. So I think I've wandered around a bit there on that answer, but it's all kind of tied together. It's the degree of community spread as well as the specifics of certain settings. So I'd certainly turn to Chris or Ruth if you have anything a little bit more on point about what we know about places of worship as particular site concerns.
One thing I'll add that is very personal, but one of the things that has been discussed at the place where I worship is the concern that even if they could open up, their concern is for the members who are in vulnerable groups who would so want to be a part of the community that it would be too much of a pull. And so we get people who would be particularly at risk that would want to attend. And I think that I've appreciated that perspective. And for me, that's been important to keep in mind that, what may seem to be okay for a certain segment of the population could have devastating consequences for others. And so to be willing to consider that need higher than our own. So that's not scientific, but that is been part of my personal experience, and I thought it was a wise comment.
Thank you.
Your next question comes from the line of Jeremy Olson with Star Tribune.
Yes, hi. I had received a tip that yesterday the governor was going to go with a more liberal opening policy for restaurants and bars, not just patios only, and that the health department's encouragement brought that back to the level we have today. Can you confirm that? Was there a more broad recommendation being recommended, and then the health department with concerns for the community had that changed late?
Well, what I can tell you is, and I think we've said this in the past, that there's been multiple scenarios considered and debated, multiple options evaluated with legitimately different perspectives about the importance of taking very seriously the economic harm that is being done to people and communities and across sectors by the virus and the restrictions on activity that we've taken as public health measures to try to prevent the virus from overwhelming, from creating unnecessary illness and death, and from overwhelming the healthcare system. So those perspectives have been in tension all along. So all I can tell you, I certainly can't comment, don't have insight into, the governor's thinking process, but he welcomed and heard us talk through a range of options. So, and that's been true in all of his prior decisions. So he doesn't just look at one thing, but considers multiple points of view and multiple options.
Related follow-up then, since it sounds like the state fair is saying we're going to have a fair or we're going to have no fair, we're not going to do a middle ground. What has been the health department's current advice and guidance on whether there should be a fair or not?
I know that the state fair board is thinking about that and is, I believe, going to make a recommendation to the governor. The conversations that we've had have just been about the state of the epidemic and where we think we might be by the late August, early September, and unfortunately, everything we see, even if we're past the peak, which we expect to be, there still will be a great deal of community spread and a great risk of transmission. So we've just simply been sharing the data, and we are not making a recommendation to them, but certainly appreciate the care with which they're thinking about this.
Operator, we have time for one more question.
Your last question comes from the line of Kent Erdo with Care Television.
Yes, I kind of wanted to follow up, first of all, on the comment about the graduation ceremony. Was that in Minnesota? Can you give us any more detail on that?
Yes, that was in Minnesota, and that's the level of detail I can provide.
So they were, I'm just trying to understand. So this was a ceremony that they were planning to do that would have gone against the state guidance?
It was a ceremony that they did do that went against the state guidance. And one of the individuals, so not at the ceremony itself, but one of the individuals who was part of the setup was identified as having COVID. That person exposed people who were part of the ceremony who did not realize, before the ceremony that they had been exposed, and so therefore were not quarantined. So it's just an example of how, this could potentially have an impact on a large number of people. And so we want people to be aware that the guidance related to graduation has not changed.
Can you tell us any more about the size of that event and how people have been contacted? Has there been more testing done? I mean, certainly that would be a huge red flag, potential hotspot or spreading event. We are working on doing follow-up, and we'll be assessing, the situation. Keep in mind that our guidance for a contact would be 15 minutes within 6 feet. So that will make a difference. But the bottom line is that, there is transmission that's occurring within the community. And this is why we have made the recommendation that we have related to graduation. We did hear, and it was referenced earlier, about the potential of some cases up in central Minnesota with the church. Are there other issues? We don't hear about these very often when it comes to an incident like the graduation ceremony or maybe with the church. Are there other potential instances of, say, spreading events in some congregate settings outside of living? I mean, in churches or in ceremonies like this, or restaurants or areas like that?
Well, there to this point, there should not have been any restaurants open nor church gatherings. So
All right, I want to thank everyone. That is all the time we have for today. Thanks again to our speakers and to the reporters on the call. If you had a question we were not able to get to, please feel free to reach out to our office. Have a good day, and we'll talk again soon.
And that was today's COVID-19 call by state leaders. The governor was not on the call today.